Welcome to Canadian Justice. I'm Christine Van Gyn, and today we're talking about a shocking case from Ontario involving a disgraced fertility doctor who helped hundreds of families conceive children, but allegedly did so by using the wrong sperm or even his own. The case has been certified as a class action with 226 class members, including former patients and their children. 17 of those children have discovered through DNA testing that Dr. Barwin is their biological father. In 2019, the College of Physicians and Surgeons stripped Dr. Barwin of his medical license for professional misconduct. And Dr. Barwin has now agreed to an over $13 million settlement with the people in the class action. He says the settlement is not an admission of wrongdoing. How did this happen? And what laws are in place to protect patients and their future families from this type of egregious misconduct? And is there more than just misconduct? Is it fraud? Is it criminal? Today, we'll be discussing these issues and more. We're joined by Kevin Martin from the Donor Conceived Alliance of Canada, fertility specialist and professor Dr. Arthur Leder, and Francis Shapiro-Munn, a lawyer involved in the class action against Dr. Barwin. Thank you all so much for joining me today. Now, Ms. Munn, you're involved in the class action. Can you explain the details of the case? And perhaps how did these patients find out that their doctor was in fact the biological father of their children?
Yes, thanks for having me, Christine. The details of the case are that, as you've said, families over the course of about 4 decades, so we're talking from the late 1970s through to about 2012, saw Dr. Barwin for his assistance in conceiving children. And these families were of all different types. A lot of couples saw him where the man and the couple's sperm was to be used. Same-sex couples saw him where donor sperm was to be used. Single women saw him, again, where donor sperm was supposed to be used. And what we've learned through this case is that over these 4 decades or so that he was helping these families, there were many mix-ups in the sperm. What's gotten the most attention is the fact that his own sperm was also used, but there's mix-ups even beyond that. A lot of families who just don't know who their biological father is.
Mr. Martin, what can you tell me about the type of impact emotionally that this type of mix-up would have on children and young adults and their families?
Well, I can tell you that those 226 class members right now will never be the same. This is a trauma that really no amount of money can compensate for. And this happens under the cloud of anonymity, where we still have anonymous gamete donations in this country. And for people that are finding out as adults that this type of violation occurred, it's just heart-wrenching, and they're going to have to deal with this for the rest of their lives.
So Dr. Leder, this physician has agreed to settle the case, but he is admitting to no wrongdoing. So how exactly is he explaining himself?
Thank you again for the opportunity. I've never seen any explanation from Dr. Barwin. Most of what I've read has been sort of the records from the college or the class action. I don't think he's ever offered an explanation. Initially, he said someone said on his behalf that there were errors attributed to clinical errors by his staff, but ultimately it was accepted that his practice and record keeping were sloppy. That's with the donor sperm. And with the fresh sperm, initially he stated that the paternity must have occurred as a result of accidental contamination, resulting from the failure to clean a counting chamber that he used to calibrate his own sperm and the husband's sperm. But Dr. Edward Hughes, who's a college assessor, reviewed this and said that there were several reasons why his explanation was implausible, and concluded that it couldn't be the cause of all the errors that Barwin alluded to and that he's been accused of. So I've never seen an explanation. Maybe Ms. Munn has seen an explanation, but I've never heard anything from Dr. Barwin directly or read anything directly.
Yeah, when we come back from this commercial break, Ms. Munn, I want to ask you that exact question. If this was intentional or sloppiness, or if he was using his own sperm for some type of bizarre reason, or if this was just a matter of poor record keeping or something like that. We will be right back after this commercial break. Welcome back to Canadian Justice, where we're talking about the case of a disgraced fertility doctor who used the wrong sperm or even his own sperm to help families who were trying to conceive children without their knowledge. Now, Ms. Munn, I wanted to ask you what I asked in the last segment about how the doctor explained his conduct. What was this, just sloppiness, or was he using his own sperm or making these mix-ups for some other bizarre reason?
Well, we don't have an explanation beyond what has already been out there. And as Dr. Leader covered, the only explanation we have is that it was accidental. And we don't have any evidence or anything else to suggest otherwise. And this is frustrating, I think, for a lot of people. People often come to us and want to know why this happened. But what we find more and more, and just going back to something Mr. Martin was saying, is that ultimately the impact for all these people, no matter the motivations or the why or the how, the impact is the same. It happened. And now these class members, we have the 226 people have to learn to live with the fact that this happened.
Dr. Leader, this physician was involved in his problems date back quite a ways. He had inspections in 1999, 2002, 2010, and I don't think it was until 2010 that anything was ever done. So what were the problems with those earlier inspections, and why did nothing happen after problems were discovered?
Well, the first inspection, this is by Health Canada under what was called the semen regs, which are under the Food and Drug Act, which is a criminal law, as I understand it. And in 1999, all of the donor sperm that he had stored at the clinic had to be quarantined because he couldn't provide the necessary paperwork required by the law, including whether the sperm had passed safety assessments for diseases like HIV and chlamydia. So on June 25th, he was told to immediately quarantine all of the semen currently in stock and stop using it. Unfortunately, instead of saying that he was non-compliant, which would have shut him down, Health Canada did nothing. They did a second assessment in 2001, and no confirmation was indicated that he complied with the concerns that were addressed in 1999. They did another inspection in 2002 and found that none of the donor sperm files were reviewed, included the necessary paperwork to confirm the safety of the sperm. They noted that samples were missing from the recorded inventories. Files were found to be no longer viable. Patient consent forms necessary to use donor sperm were missing. Yet in 1999 and 2002, he passed the inspection as compliant when he wasn't. He failed an inspection by Health Canada in 2010, and they found that 3 of the failures were critical or dangerous. Once again, there are problems including missing evidence for the testing for infectious disease, missing consent forms, missing donor sperm vials, and labeling problems. So it really fell on Health Canada and the inspectorate to have brought this to the attention of the government. And under the law, as I understand it, he should have been shut down until he became compliant. Furthermore, Health Canada was under no obligation to let the College of Physicians or any college know of non-compliance. So you have 2 regulatory entities that are functioning in a vacuum and not actually communicating with each other, which, to my mind, compounded the problem.
Yeah, I mean, that's a huge part of the problem. If they knew there was something wrong and they didn't tell the college. Now, the class action, as I understand, is for just over $13 million. As I understand, Ms. Munn, it's for $50,000 per person. Is that correct?
Yes and no. It's up to $50,000 for various categories of patients. So there's fundamentally what we've identified as 3 different categories of patients who were harmed. The first category is couples who saw him with the intention that the man and the couple's sperm be used, that the father be the biological father. The next category are people who saw him intending to receive a donor and the wrong donor was used. And then the third category are men who left sperm with him, not to be donors, but say to preserve their sperm before undergoing medical treatment or for their sperm to be used on their wives. And they've now found out that they've got a biological child out there who was conceived at his clinic. So those are the three, what we call broadly the three categories. And the highest category, that first category, the man and the wife, they could get up to $50,000.
When we come back from this commercial break, I want to talk to you, Kevin, about the amounts involved in here and whether or not you think they're satisfactory to compensate for that type of harm. I'm sorry I didn't get to get you in this segment, but we will be right back. Welcome back to Canadian Justice, where we're discussing the case of a fertility doctor who used the wrong sperm and even his own sperm in fertility treatments with families only finding out years later that the wrong sperm had been used. Now, Mr. Martin, when we left on the last commercial break, we were talking about the amount of money involved in the class action settlement here. It's $13 million, with the maximum being for families who had a mother and a father who had their own sperm that they wanted used to conceive a child and the wrong sperm was used. They can get up to $50,000. There are other categories, as Ms. Munn went over. What is your feeling about the amount of money involved in this class action settlement? Do you think it's enough? Could there ever be enough to compensate for this damage?
Well, it's really hard to say. On the surface, I don't think any amount of money will ever do justice to those families. And what's really unfortunate is that we had to get to this point. And this lawsuit had to do for donor conceived people what our institutions failed to do, which was protect us. And so this is obviously a step in the right direction. It's a precedent-setting lawsuit. As far as I know, there aren't any other jurisdictions in the world that have taken this step. And I'm hopeful that the precedent that is set with this case will transfer to other jurisdictions around Canada, the United States, and around the world. So the physicians that betray the trust of their patients in the fertility industry can be held accountable.
Now, one of the things that's unique about this class action settlement is it includes the creation of a DNA database. So, Mr. Martin, what can you tell us about that database and how you think it can help the victims in this case?
Well, with donor conceived people, as far as I know, we don't have accurate numbers on how many of us there actually are. The numbers that are most frequently cited in the media go back to the 1980s. That was the 30,000 per year number. However, with DNA testing becoming very popular these days, that's how a lot of us have found our truth. So having a database set up and mandated by the courts, it's going to make sure that as more half siblings pop up, that they're going to be able to find each other and pursue mutually desired relationships. And with as high as those offspring figures could get, I mean, it could be significant, and those numbers are only going to keep growing.
So the idea behind the database is that if you were one of the victims or a child conceived out of this malpractice, you could go in the database and find other people who are related to you. That's how it works, right?
Absolutely.
I mean, that's good information for people, because I know there's lots of genetic reasons you might want to know about your genetics. Now, Dr. Leader, I want to ask you about prevention. What needs to change so this type of thing doesn't happen again?
Well, I think that we need to set up a proper network. Right now, we have an unregulated patchwork of unenforceable policies that are overseen by different regulators who don't speak to each other. And I think that's what needs to happen. They need to harmonize a plan to share information between the federal and provincial regulators. And the regulators should post clinic-specific information on every inspection and detail the areas of noncompliance. when at the time that the Barwin episodes were going on, Health Canada didn't post any of the reports of whether a clinic was compliant or non-compliant. Now it does. In Ontario, there's no place where you can go to see whether your fertility clinic is compliant or non-compliant. So I think there needs to be a harmonization of regulations and reporting between the two levels of government. That may help to prevent it. On the other hand, I'm sure Ms. Munn knows that if someone has a criminal or other intent, there's no law that's going to stop them from doing that. This would just help to pick up those cases where there is some irregularity long before the children reach their 20th birthday.
Now, I want to pick up on that. Ms. Munn, is there something criminal that happened here? Are there going to be criminal charges against Dr. Barwin?
Not that I know of or that I'm aware of. In Canada, it's ultimately up to the police to decide to investigate a case and then lay charges. We really have no control whatsoever over that. That said, whenever I try and think about what he could be charged with, I really have a hard time coming up with any criminal code law that he's broken. There is no law on our books that says you cannot impregnate patients with your own sperm.
When we come back from this commercial break, Ms. Munn, I'm going to ask you if you think that needs to change. Welcome back to Canadian Justice, where we're talking about the disgraced fertility doctor from the Ottawa area who used the wrong sperm or even his own sperm to help create babies without the family's knowledge that it was the wrong sperm. Now, Ms. Munn, before the last commercial break, you mentioned that you don't think that this is a criminal offense. What about charges under, fraud or something like that?
Again, Christina, the police would have to have evidence that there was fraud here. So that's a very, very high standard, and they have to prove that it's intentional. And as we discussed earlier, we really don't have any evidence whatsoever that it was in fact intentional. He hasn't practiced since 2014. His clinic has long since closed. So I think that if the police were trying to investigate any of this, they would have a very difficult time.
And you mentioned before the break that it's not a criminal offense to use the wrong sperm to impregnate someone. Do you think it should be a criminal offense?
There are some jurisdictions, I believe, in the U.S. that have since made that a criminal offense. I have a hard time. I'm not sure that it would change anything. I think, as Dr. Leader said, if you have criminal intent in this area, having that law on the books, would it necessarily act as a preventative against someone doing this again? I don't know. I hope these cases are rare enough that no one ever in this country does it again. And I wonder if efforts are better served to beef up our regulatory regime, especially the provincial federal regime, such that they can communicate better between them.
So, Mr. Martin, we can't forget about the voices of the children who were affected here. What role do you think the donor conceived or the child victims in this case have in calling for reform?
In terms of the U.S. jurisdictions that have created laws on the books, some of the most powerful testimony has come from the victims in calling out what was done to them, being the product of their parents being impregnated by the fertility doctor without consent. And donor-conceived people around the world, we have to be meaningfully engaged in any regulatory process that involves us. And that's been part of the problem over the past years. It's been just getting a seat at the table has not always been easy. And the adoption community has been engaged. They were meaningfully engaged when Ontario opened records in 2007. And we need to make sure that our community is heard.
Now, Dr. Leader, we've got about 1 minute left. What can you tell families who would like to use fertility services? How do you reassure them that something like this is unlikely to happen? Because this is how a lot of families conceive their children. How can you reassure them?
Well, I think as was stated, that it's rare. In my experience, I've been doing this for close to 40 years. It's rare that this type of behavior has occurred. And so I think they can be reassured by and large by the fact that there are unlikely to be other people who are doing this behavior. But I think to look at the clinic and to say, has the clinic been inspected by Health Canada? Has it been found to be compliant? To push their provincial MPPs, there is a proposal from the college to regulate all fertility clinics in the province, but the provincial government has not been forthcoming with the change to the law that's necessary.
Well, I want to thank all three of you for coming on today. Unfortunately, that's all the time we have.
Thank you.
Thank you, Christine.
We've heard today about the shocking case of a fertility doctor who's been sued for using the wrong sperm, and even his own sperm, without consent during fertility treatments. His conduct has caused huge damage to families and to children who only recently learned that the father who raised them is not their biological father. This will have generational damage and will have huge emotional impacts on these children and their families. Pope Francis recently said that fathers are not born, but made. A man doesn't simply become a father by bringing a child into this world, but by taking up responsibility to care for that child. Nothing Dr. Barwin did made these men any less of a father. But what he did does need to face consequences. Is $13 million enough? Do the laws need to change so that no other families are put through this? You be the judge. I'm Christine Van Gyn, and remember, a freer Canada starts with you.